This micro-program is brought to you by the Ministry of Public Health and the Ministry of Communication in collaboration with the African Union, Africa CDC, and the Mastercard Foundation.
Today we are connected with Professor BOUM, who is an epidemiologist. Welcome, Professor. Tell us, how important is the vaccination against COVID-19?
COVID-19 has killed a number of people, a million of people around the world. In Cameroon, killed more than 1,000 people. And the vaccine that we have now is used to reduce the severe form of the disease and also to limit the death. So the people, especially those who are vulnerable with age more than 50 or having comorbidities, are the most at risk. So those people must take the vaccine so that it will prevent them from developing severe form or even dying from COVID-19.
Why do we need to get tested for COVID-19?
It is critical to get tested for COVID-19 so that we know our status. There are two options. The first option, we are negative. If we are negative, meaning at this very point of time, we don't have the virus, so that we can carry on our activities, and we have to respect the distancing measure, including washing the hands, wearing the mask when we are in public. In case we are positive, then we know that we should first start our treatment in case we are symptomatic, and second, we need to isolate ourselves.
How important is the health pass?
The health pass is definitely the pass for us to allow our community, our people, all the African community in a position to enjoy the African Cup of Nations. It has two critical elements. The first one is the testing. We want every people attending the game or going to the fan zone or to the hotel that is dedicated to the Can to be negative for COVID-19. So that's very critical. And then for those who could be exposed to COVID-19 during the event, we don't want them to have any severe form nor to die from COVID. So the second element is the vaccination.
What can you tell us about COVID-19 variants?
The COVID-19 pandemic has been there for the last 2 years. So the virus, the SARS-CoV-2, had time to evolve and mutate. We start with the alpha, then the beta, and then recently the delta, and now we have the Omicron variant. It is a combination of a virus that has a high number of mutations, around 48, and the specificity of that very Omicron is that it has very high transmissibility, which means a large number of people can get contaminated in a very short time. In the other hand, we can see that the severity is quite less as compared to the other variant. So we are having a variant that is, one, highly transmissible but less severe.
What is the evolution of the COVID-19 pandemic?
The COVID-19 pandemic has been there for the last 2 years. So the virus, the SARS-CoV-2, had time to evolve and mutate. We start with the alpha, then the beta, and then recently the delta, and now we have the Omicron variant. It is a combination of a virus that has a high number of mutations, around 48, and the specificity of that very Omicron is that it has very high transmissibility.
What advice can you give to the population to avoid the transmission of the COVID-19 during the TotalEnergies Cameroon 2021?
The first advice to make sure that we are enjoying the competition, it is really a huge African party, is the respect of the distancing measure. The first one, very simple, is to wash our hand with soap and water or using the gel as much as we can so that we really stop the virus from getting to us or to transmit to others. The second one is for people who would like to go to the fan zone, to the hotel dedicated to the Can, but more importantly to the stadium. All those people must have their health pass, which include the testing, which is done 24 hours before the game, so that we are clear, we ensure that all the people who will go in the stadium will all be negative. And the second one is the vaccination.
Thank you, Professor, for your lightning on COVID-19. And for you, stay safe.
This micro-program has been brought to you by the Ministry of Public Health and the Ministry of Communication in collaboration. with the African Union, Africa CDC, and the Mastercard Foundation.